I want to start by acknowledging the traditional owners of the lands on which we are all meeting today and pay my respects to Aboriginal elders past and present. I just wanted to speak around Best Start and the potential alignment with SRF. For those of you who don't know me, my name is Rachel Mullen. I am currently Senior Policy Officer with Best Start and have been for the last 5 years working out of the central office. I do that 1 day a week, and the other 4 days I'm an early childhood performance and planning advisor in the Wimmera Southwest area. I just wanted to give a brief outline really of the Best Start program. So the Best Start program uses improvement science to improve outcomes for Aboriginal children and children experiencing vulnerability. That category of children experiencing vulnerability is quite broad, and you'll see in the example that I provide a little bit later that there's plenty of different categories, and it really relates to what defines vulnerability in your particular area. So the program does this by focusing on improving the engagement of those children in universal services. So we look at MCH kindergarten and also supported playgroups. While DET no longer funds maternal and child health and supported playgroups, the program has traditionally focused on those. For the purpose of today's presentation though, we'll look at the kindergarten aspect of it. Best Start is a partnership model, so we've got partners working together to try to improve outcomes. So they come up with a logic model each year, and that is facilitated by a facilitator, and they use a strategies from the logic model to identify small changes in practice that they can test within their organisations that's going to lead to improved outcomes, and the facilitator guides and supports this work. There are 30 Best Start sites across Victoria. I've divided them up here into regions. There's 6 Aboriginal Best Start sites, which are the ones that are bolded here. So not everybody will have a Best Start site in their area, but I suspect that most of you will. So the purpose of today is really to work out how Best Start and school readiness funding objectives align and what we can do to support that work from a department perspective. So Best Start sites use data to inform their area of focus in their logic model each year. So that does actually include data sets that our kindergarten providers will be looking at as part of their school readiness funding planning. So it might be AEDC data or kindergarten participation. It could be deeper than that, looking at quality of kindergarten services through the national ratings. There's a whole heap of different data sets that our Best Start partnerships draw on to inform their logic model development. But in particular, Best Start sites look at which cohorts are missing out, and they identify their barriers to participation. So all of our sites focus on Aboriginal children, whether they're experiencing vulnerability or not. But in terms of the children who are experiencing vulnerability, there's a whole heap of different defining categories, I guess, and we look at some of them here. So we've got, kids in out-of-home care, known to child protection, refugee children, children from culturally and linguistically diverse backgrounds, children with a disability, children who may be experiencing domestic violence. So as such, given those cohorts, it's likely that the Best Start priorities in an area will often align with the planning for school readiness funding. So this is a sample logic model. This one's from Maribyrnong, and this informs their work for 2020. And if we look first at the focus group, you can see the cohorts they're focusing on, and it pretty well covers all of that list that I had up before. So refugee, asylum seeker and culturally and linguistically diverse, Aboriginal and Torres Strait Islander, kids known to child protection and or in out-of-home care, and those supported by enhanced MCH Child First or integrated family services. So that's their focus groups. Then you can see the inputs. This is all the people who can help them to do the Best Start work. Then they've got their strategies. So we'll actually just skip over to the right-hand side for a moment where we have the Best Start outcomes. You can see that the Best Start outcomes are children engage and participate in early childhood education, and children and families actively engage with maternal and child health services, attending key ages and stages visits. So they're the longer-term Best Start outcomes, and then they develop short-term outcomes. So in this case, they've looked at service accessibility and service continuity and collaboration. Then you go back to the strategies, and that's how they're going to do this work. So you can see in the short-term outcomes that they want to increase, for instance, attendance and active engagement of children and families enrolled in funded early childhood education. And so the strategies are how they're going to achieve that. So taking a bit of a closer look at the aspects of the logic model that align fairly closely with school readiness funding, If you think about the cohorts that were the focus of this work, you can see that the outcome in yellow nicely aligns with the school readiness funding outcomes. In this case, specifically around access and inclusion, but there may also be Best Start sites where communication or wellbeing may also be a particular focus that you could potentially align the work. So here, if we look at the SRF menu, you can see that each of these are the first 9 access and inclusion menu items that you can see when you click on the school readiness funding menu. And you could see that you could potentially use any of these to achieve those outcomes that were listed on the previous slide. Because here it's pretty clear that these are just 5 that I randomly selected of those first 9, and there are a heap of them that align really nicely with these particular outcomes. So we're going to look now at how you can potentially link the school readiness funding planning and work with the Best Start work. So for Kias, the first step is to understand what your local Best Start site is focusing on. So if you can make sure that you connect with your local Best Start facilitator, that is a fantastic starting point. So ECPAPAs in the areas all know who their Best Start facilitators are, but if you have any troubles identifying who you need to connect with, then you can feel free to contact me as well, just to get some more contact details. But the Best Start facilitator is the first point. Hopefully most of the facilitators would have already connected with Kias, but as it's a new role in some areas, that may not have happened just yet. But once you've done that, made that connection, it's really good to look at if there is a link between Best Start objectives and school readiness funding objectives in your area. Again, because of that use of similar data to inform the planning, it's likely that there will be some kind of a link. And then look at if there are individual services in your area that are using SRF in a way that aligns with the Best Start objectives. Then we start to think, if we do know that there are services that may be doing work that does align with Best Start, the question is, can services benefit from working with Best Start? So can services strengthen their outcomes if they work in a way aligned with the Best Start improvement approach? Will use of measurement in the Best Start context strengthen data collection and improved outcomes for children in your area? So one of the really important things about Best Start is that it takes things such as learning and puts them into practice. So if someone does some PD, for instance, say they do Bridges Out of Poverty PD, if they take that PD and don't ever actually embed it into their service delivery, then the PD was obviously worthless. Now, the way that Best Start works is that it takes things such as the learning from PD and it gets people to think about what they could potentially do to change their practice in a very small way next week, and just test that change in practice and see if it has an impact on the outcomes for kids. So where I can see the Best Start program aligning really closely is when services do undertake some PD that does align with these particular outcomes, that Best Start facilitators could really support the services to embed the learning from the PD into their services using this improvement approach. So looking at a couple of the ways that school readiness funding could align with the Best Start work. The first one is around resources. So given that we're talking about outcomes for Aboriginal children or CALD families or children experiencing vulnerability in the Best Start work, we can see that there's obviously heaps of different menu items, and I'm only vaguely familiar with the menu, but these are a few of the ones that just sprung out instantly that could be potentially used to purchase resources. Now, Best Start isn't a resource program in that there's no funding for resources. However, what could be done is that the Best Start facilitator could support kindergarten services in the use of these resources and how they can improve outcomes for those children in those target cohorts using those resources. I'll get to an example in a minute that might make it a little bit more clear. Professional development is another way. So Best Start's really helpful in embedding the learning from professional development in the services. So Best Start facilitators can support this work. So if the objectives do align from a school readiness funding perspective with the Best Start objectives, then this is a good opportunity to align this work. I'll show you an example of how that's happened already. So just looking at this example from Dalkai Aboriginal Best Start, services in Yarra-Yambyak Shire selected, the Yarra-Yambyak Shire, sorry, just to go back, is an EYM. They selected Aboriginal cultural supports from the school readiness funding menu and approached Goolam to be able to offer some kind of professional development. So through the Dalkai Aboriginal Best Start program, PD was actually provided to the services there, and it was around improving cultural safety of services for Aboriginal families. But the last section of the professional development involved each kindergarten coming up with a change in practice they could make next week and writing that up as a plan, do, study, act cycle. So in Best Start, these very small changes in practice are run through what is called PDSA cycles. And basically in the PD itself, they did the plan part of this work. So I just planned what they were going to do. So a really small change in practice they could do next week. So it might be around embedding a new acknowledgement of country each day. It might be putting up the Aboriginal flag. It might be talking with children about some part of Aboriginal history. So they did the plan part in that particular PD session. Then each service went away from the PD and tested that change in practice. The Best Start facilitator then followed up with each service to discuss what they did, what they'd learned, and complete the rest of the PDSA template. So that is, they entered what was done in the do section, they reflected on what was learnt in the study section, and then they decided together what they would do next in the act section. So they'd either adapt the existing PDSA, they'd abandon it because it just didn't work, or they would adopt is the third A. I couldn't think of it for a second. Adopt that PDSA and into their service delivery. So they may find after they've run through a couple of cycles of a PDSA that it's really working effectively and having the impact that was expected. So they decide to adopt that into their daily practice. So services will then adapt, adopt, or abandon whatever was done in that small change in practice the first time. And if they do adapt, then what they do is they do another PDSA cycle and make another small change in practice based on what was learnt in the first PDSA cycle. So this is a way that a Best Start facilitator can support services to embed learning from professional development. It might be even from allied health, for instance, in a way that's tangible. It works toward Best Start outcomes, but it also works to support services in embedding their school readiness funding and really getting a good sense of what they've actually achieved in terms of outcomes for kids on the back of their school readiness professional development, for instance. I'm hoping that this has given you a little bit of an idea about how the Best Start work can potentially align with the school readiness funding work and how you guys as Kias could link up with Best Start facilitators in a way that will support Best Start facilitators, but also support services in your area to actually embed their learning that they're getting through school readiness funding. So really strengthen the outcomes for kids in our areas. But I know that it's quite a complicated program in some ways to get your head around completely. And so it is very much just an overview around it. I haven't really touched on the measures that we use in Best Start in great detail. So I feel like there's still a fair bit of information that I could probably provide, but I figured this is sort of the best starting point. But if you want any further information, feel free to email the Best Start at education.vic.gov.au email address, and there's just the details of the Central Best Start team if you have any further queries. Thanks heaps for your time.